Well, thank you very much, Sosha. Apologies from Sarah Collinson, who's unfortunately unwell today and is unable to make the discussion. But just to give you a little bit of background to the report, we basically organized a roundtable series in 2010-2011 with a series of partners looking at different aspects of humanitarian space, focusing on issues related to the concepts and meaning of humanitarian space. We looked at the role of the humanitarian system and what impact that had on humanitarian space. And we also looked at issues of UN integration and of counterterrorism legislation to understand their impacts on humanitarian space, and two case study roundtables, one in Nairobi on Somalia and the other here in London on Sri Lanka. And what the report tries to do is try to summarize some of the key issues that emerged from that roundtable series, but also build on some of the arguments that were being discussed. The actual meeting summaries are on the website if you're interested in the particular detail around that meeting. And there's also a Somalia case study that Laura Hammond and Hannah Vaughan Lee have put together, which is also available here today. So in terms of the report, I think we've intentionally tried to make the arguments quite provocative and challenging because we really felt that there was a need to kind of question the common narrative that exists on humanitarian space. Now, this common narrative essentially suggests that there's a widespread consensus among humanitarian actors that humanitarian space is shrinking. And this is largely attributed to the politicization of humanitarian aid, particularly since 9/11, with humanitarian action being co-opted into the political and security strategies of the West. And I think the most ubiquitous theme within this narrative is that essentially things are getting much worse than they were in the past. So access is becoming more difficult, attacks on aid workers are increasing, aid is becoming more politicized, and respect for humanitarian principles and IHL is declining. And whilst there are many different definitions of humanitarian space, and many humanitarian organizations recognize the importance of humanitarian space also being about people's access to relief and protection, within this narrative, essentially humanitarian space is primarily concerned with the ability of international aid agencies to operate and provide materials assistance, a concept that is probably better defined as agency space rather than humanitarian space. Furthermore, humanitarian space is generally understood as a space that exists separate from politics, hence the concern with politicization, and that in order to reverse this politicization, there is a need for a renewed commitment to the traditional principles of humanitarian action, mainly impartiality, neutrality, and independence. In other words, we need to return to what is deemed to be quite a clear, solid, and predictable model. That is, by upholding these principles and remaining outside of politics, an agency's access will be guaranteed. And in the report, I think we've tried to argue that this narrative doesn't hold true on two main accounts. The first is that we don't believe that there is a humanitarian space that exists outside of politics. So all access is based essentially on political compromise and results from the interplay of a range of actors, interests and actions. And I think that's why we've defined humanitarian space as a complex political, military and legal arena. And I think if we do see humanitarian space as being largely outside of politics, I think we run the risk of applying a technical approach to these issues and subsequently divert attention from the highly political nature of many of the challenges we face, or the humanitarian sector faces today with regards to humanitarian space, such as attack against aid workers, the killings of civilians in conflict, and the co-option of humanitarian aid in stabilization or counterinsurgency operations. The second point is that even if we take a cursory look at the history of humanitarianism, I think the idea that things are getting worse now than they were in the past is not as clear-cut as the shrinking humanitarian space narrative actually suggests. So we undertook a brief historical review of humanitarian action since the Cold War, and we found no past golden age of humanitarian action, no clear, solid, predictable model that humanitarians often frequently evoke. And just to illustrate, during the height of the Cold War between the 1950s and 80s, we see an escalation of conflict in the so-called Third World, causing massive human suffering and refugee flows. And by modern standards, the international humanitarian response was minimal. So respect for norms of sovereignty meant that few organizations were able to respond in the midst of conflict and were relegated to assisting refugees in camps. NGOs did not represent a major force in international humanitarian action, and at the time most UN agencies were not centrally involved in these conflicts either. And the negotiated access model, with humanitarian organizations working on both sides of the conflict in places such as Angola, Mozambique, Sudan and Ethiopia, gained prominence with the waning of Soviet influence in Africa and the growing sensitization of Western publics to humanitarian suffering. But these, however, were mainly short-lived initiatives, and in the 1990s, neutrality was frequently abandoned in favor of a more militarized humanitarianism. And this military humanitarian alliance was particularly pronounced in Kosovo, with NATO charged with coordinating the humanitarian response in what was essentially labeled a humanitarian war. So I think rather than a shrinking of humanitarian space, we could even argue today that we're seeing an expansion of that space, in the sense that there are more humanitarian organizations, there's more aid workers, there's more money being consistently given by governments and the general public, and aid agencies are trying to operate in the midst of conflict zones. In fact, sovereignty has become contingent on upholding certain responsibilities and towards populations. And I think that's quite a radical shift from prevailing norms that existed during the Cold War. And in the report, we argue that it is perhaps this expansion of the humanitarian sector into conflict zones that might actually be one of the reasons why we're seeing so many challenges with regards to humanitarian space. Humanitarian action has always been difficult and dangerous in situations of active conflict, where violence against civilians and humanitarian workers can be a deliberate or primary tactic or objective of war. So the recent targeting of aid workers needs to be seen in this light. It's part of the general politics of humanitarian rejection, which is probably as old as humanitarianism itself, and the underlying causes of which really need to be understood. Yet, when actually trying to understand why aid workers are being attacked or why access into conflict zones is restricted, I think we're in discussions with humanitarian organizations. We found that there is a significant bias towards focusing on the policies and actions of external players. So they usually focus on stabilization operations, blurring the lines between military and humanitarian actors. They focus on UN integrated missions, undermining the neutrality of UN humanitarian agencies. And their partners. They'll focus on government counter-terrorism legislation, criminalizing aid delivery in areas that are controlled by proscribed groups, or on national governments who exaggerate their capacity to respond and deny access to outside actors to defend notions of national sovereignty. Now, whilst these external factors are clearly of significance and have been a central focus of our research here at HPG, we felt that there needs to be greater scrutiny of the international humanitarian system itself and how the nature of this system and its expansion into conflict zones might actually help us understand why the humanitarian sector faces so many challenges in difficult environments. And I think this introspection is especially important because there is a tendency to see humanitarian organizations as essentially lacking power, which is reflected in this idea that it sits outside of politics. And that they are essentially operating in conflict zones against the odds, and this is only really possible due to the morality of its mission. Yet, humanitarian organizations can be an important source of both power and contention. So together, humanitarian organizations represent a relatively powerful and well-resourced group that are able to operate separately from and sometimes in opposition to the state and other national organizations. And I think this is particularly so in contexts where states lack empirical sovereignty, such as Afghanistan, Somalia, South Sudan, and Haiti. In fact, you could argue that the aid system in some instances exercises a competing source of sovereignty. And to give you an example, in a review of UNHCR's care and maintenance model, Amy Slaughter and Jeff Crisp observed how the model, and I quote, endowed UNHCR with the responsibility for the establishment of systems and services for refugees that were parallel to, separate from, and in many cases better resourced than those available to the local population. This created a widespread perception that the organization was a surrogate state, complete with its own territory, the refugee camps, citizens, the refugees, public services, education, healthcare, water, sanitation, and even ideology, community participation, and gender equality. Furthermore, I think the power that stems from this competing sovereignty is also highly concentrated in the hand of a core group of UN agencies and international NGOs. According to UNAP's State of the Humanitarian System report in 2008, 6 of the largest organizations and federations, so that includes CARE, Catholic Relief Services, Oxfam, World Vision, Save the Children, and MSF, had a combined humanitarian spend of $1.7 billion, which is significantly larger than that of the next 11 largest organizations, which was $193 million. They also accounted for approximately 60% of all NGO staffing presence. And the dominance of this small group of organizations resembles an oligopoly. And in fact, when we had the roundtable earlier this last year on the role that the system plays in affecting humanitarian space, one commentator referred to this as the humanitarian cartel, where despite differences in missions and mandate, these organizations and UN agencies operate as a relatively closed group with interrelated histories, limited scope for new entrants, and at the international level, career paths often also span these few dominant organizations, effectively creating what we call the humanitarian establishment. Now, this establishment determines the dominant international humanitarian discourse. It defines and legitimizes the role of key agencies, and ultimately decides the terms of reference and rules of the game that define the system. And the barriers to entry into this system are reinforced by institutional structures, initiatives, and reforms, such as the Interagency Standing Committee and its various networks, the Sphere Charter, the clusters, and the humanitarian country teams. Now, while these initiatives have been created to improve the performance and professionalism of the sector, they also risk marginalizing or obscuring the numerous other actors and networks that are involved in humanitarian action. Particularly those that are not explicitly recognized as legitimate or equal humanitarian actors by the establishment. And these can include local and national government and civil society organizations, small Western-based and national NGOs that act independently of the mainstream system, religious and diaspora networks and organizations, and also local private sector actors. Now, and I think the dominance of the establishment is also reflected in the fact that discussions of humanitarian space essentially are concerned around access concerns of international aid agencies, rather than the plethora of other actors and institutions that play a role in providing relief and protection in times of crisis. Now, in addition, the fact that the bulk of the largest NGOs are from North America and Western Europe, that's in 2008, 16 of the largest donors, which provided over 90% of official humanitarian assistance, are all Western with the exception of Japan, creates the impression also that the sector is predominantly a Western construct, one that represents Western interests, mode of behaviors, and values that may be distrusted, challenged, or rejected by local stakeholders. And I think these characteristics and dynamics may partly explain why in Somalia, Al-Shabaab often perceives organizations as spies for Western governments, or why in Sudan the government also harbors similar perceptions of humanitarian organizations, or why in Sri Lanka the Sinhala media depicted a group of international NGO heads that frequently met to discuss policy issues in what they called a coffee club as neo-colonialists conspiring against the government. Yet when we discuss issues of acceptance in these contexts, most discussions with humanitarian organizations emphasize the blurring of the lines between military and humanitarian actors, the failure of rogue states or non-state armed actors to respect humanitarian principles. There's very little reflection or discussion on the humanitarian system itself, apart really from some discussion of multi-mandate organizations deemed to be violating principles by mixing their humanitarian and development work in conflict contexts. So, also in the report, what we've tried to highlight is that while the concentration of official humanitarian aid amongst a small group of organizations that do have a shared humanitarian discourse, in practice there are also important fragmenting tendencies within the system. And that essentially stem from the fact that there's no overarching authority or rules-based regime. Most actors are self-regulating, and they often act like firms do in markets. So in many of the contexts that we studied, we often see aid agencies jostle with one another for leverage, for funds, for public profile, for market share, and in many cases ignore or distance themselves from agreed norms or joint operational frameworks that were developed to support the humanitarian space when it's not deemed in their interest to do so. And this is partly because aid agencies, in addition to their commitments to principles and good practice, are also driven by competing priorities and imperatives, such as maintaining their operations, institutional presence, and their funding. And this fragmented and competitive nature of the system has also meant that it is more liable to co-option and capture by more powerful political actors. And I think we saw this in Pakistan in 2009, where the governments essentially used humanitarian actors to support their counterinsurgency strategy. And this was made very explicit in the preface to the consolidated appeals process in 2010, where the government explained how having humanitarian organizations assist those displaced from its military operations and then support their return once those operations had finished was essential to combating militancy and extremism in the country. In Somalia, we also see frequently how actors are captured at the local level by local stakeholders and gatekeepers, and maybe Laura Hammond can say something about that, which, as she documented in her case study. And in fact, in both contexts, in Pakistan and Somalia, a variety of joint standards, principles, and code of conducts have been developed to address problems of humanitarian space, but have largely been ineffective as they've been adhered to more in the breach than in the observance. And I think these failures to prevent the big picture political capture of humanitarian organizations are ultimately not fully recognized or addressed in debates about humanitarian space. The focus when discussing humanitarian space tends to be on technical issues or applying technical approach to what are clearly political issues. And I think this is evident in the new security paradigm, which emphasizes the institutional imperative to be present, particularly in high-profile conflict countries. In other words, it's essentially how to stay as opposed to when to leave. Yet there is very little reflection on the means of what it really means to be present and what the ultimate objectives of these presence are. So with regards to the means of being present, we see aid agencies frequently rely on national staff or subcontract to national and local organizations of various kinds. In the most extreme cases, such as in Somalia and Darfur, they're dependent on remote management techniques, or they're bunkerized in fortified aid compounds that represent highly visible and separate islands of modernity that expose the exclusivity of the international humanitarian system and its unequal relationship with the surrounding environment. And I think this trend suggests that many humanitarian organizations are seeking to expand their reach into violent conflicts, but without being fully willing or able to take on the associated risks directly. So instead, these practices effectively transfer the risk away from the center of these organizations to the individuals and organizations at the margins, often with little oversight or knowledge of what national staff, partners, or subcontractors are actually doing or experiencing on the ground. And I think Somalia is a good example of this. And with regards to the aims of that presence, current guidance on operational security management is mainly about managing the risks for international or national humanitarian agencies. It's essentially about expanding or maintaining agency space. Now, whilst these stratagems and mechanisms might be effective in protecting international aid organizations, they do not necessarily protect civilians in the same context. And I think we saw this in the mid-1990s in the former Yugoslavia, which was epitomized with the concept of the welfare dead. But perhaps more recently in Sri Lanka, whilst the responsibility for the failure to protect civilians during the last phases of the war lies with political authorities, the majority of humanitarian agencies all but jettisoned minimum standards on civilian protection and chose to prioritize their ability to deliver material assistance over advocacy on behalf of Tamil civilians that were facing massive human rights abuses, and a decision that I think many individuals working for those agencies now express with considerable regret. So in conclusion, I think discussions on humanitarian space really need to kind of recognize the broader meaning of the term, which includes the protection as well as the material assistance needs of populations. And I think a reading of the principle of humanity reminds us that humanitarian action cannot simply be equated with the material provision of relief. So the Code of Conduct of the International Red Cross, Red Crescent movement and NGOs basically defines humanity as to prevent and alleviate human suffering wherever it may be found, to protect life and health, and to ensure respect for the human being. So it's quite a broad definition, and equally international humanitarian law is also quite clear that international aid agencies do not have a monopoly on this, and that other actors such as armed groups and militaries have primary roles and duties in ensuring humanitarian space. And I think the debates of the 1990s, with their emphasis on the importance of scrutinizing the conditions of access, the impacts of humanitarian aid, have somehow been lost in current discussions of humanitarian space. And I think returning to some of those concerns could go a long way in addressing some of those challenges. And I think that this would include, alongside efforts to maintain operational presence, some discussion of the minimum conditions in specific contexts that would perhaps prompt a withdrawal or a suspension of activities if the costs of maintaining a humanitarian presence was deemed to be too high. And I think any such decision really needs to be made within a clear ethical framework, with the costs and benefits of the course and action articulated in a transparent manner. And I think this will require more strategic thinking and analysis that identifies who are the key actors in the humanitarian arena, what their goals and objectives are, and what are their incentives for respecting the rights of affected populations to receive relief and protection. And I think in turn it will also require humanitarian organizations to more strategically negotiate amongst themselves on how they can actually influence some of those dynamics. And I think in the report, a central obstacle that we found to that approach is that there's often these contradicting, centralizing and fragmenting tendencies within the system. So organizations can cherish their autonomy as it allows them the freedom to negotiate their own presence, to pursue their own programs, and to make their own compromises according to their specific mission and mandate. It may also allow greater scope to adapt to the complex political and security environments that they're trying to operate in, both at the individual agency level, but also for the wider sector. And I think if enough aid agencies can maintain some level of financial independence, they can also protect themselves and protect the sector from political capture by donor governments. But collectively, however, if agency autonomy risks also encouraging a slight anarchic free-for-all which favour limited and fragmented tactical engagement with armed and other state and non-state armed actors to secure individual agency space, rather than any joint principled or strategic engagement to influence humanitarian space more broadly. And I think to overcome these obstacles, humanitarian actors really need to see what kind of compromise they can make between this anarchic autonomy and top-down authority within the system, perhaps recognizing the value of different approaches in different contexts. I don't think that will be easy, but I think essentially that endeavor is central if we are going to try to promote a humanitarian space that looks beyond the role of international aid organizations. Thank you.